Welcome to the Equine Vet Connect podcast. I'm your host, Dan Carter. I'm a veterinarian and a farrier. The goal of this podcast is to educate horse people, break things down, bust myths, and keep it real. Speaking of breaking things down, here's my legal disclaimer to keep my attorney and insurance company happy. While I am a vet, I may not be your vet. Contact them before trying anything you hear on this podcast. Remember, just because you watched it on YouTube or heard it on a podcast does not mean you can do it. Please use common sense. All right, welcome back to the Equine Vet Connect podcast. I'm Dan Carter. We're here at Countryside Equine Hospital. Actually, I have a great guest today, Dr. Ginger Johnson with the Renovo. Some of you may be familiar, but if you're not, you're gonna be in for a great podcast today because we're gonna take a deep dive into Renovo.
Sure, that's exciting. Yeah,
it is really
I'm so
awesome.
happy to be here. It's good.
That's great. Well, so Ginger, you're a human chiropractor, correct?
Yes, I am.
How did you get involved with Renovo? Because you've been there since the inception. So
Oh, yeah.
How did you get involved with this?
So I practiced human chiropractic for about 15 years in Arkansas, which is where I'm from, and my husband and I were McDonald's owner-operators, okay? So
cool.
after I practiced McDonald's, practiced chiropractic, we went into McDonald's, okay? And I was actually a McDonald's owner-operator. I went to Hamburg University and all the things, yeah. But I would just kind of dabble with patients a little bit, and I had a patient that had a spinal cord injury. And I had a friend who was an interventional radiologist, and I kept saying, man, this guy's cord is not severed. There's got to be something we can do for him. So I kept thinking about stem cells and first one thing another, and he said, Ginger, you really need to take him to Scottsdale, to this neurologist in Scottsdale. So long story short, that neurologist used the human version of Renovo, if you will, and it was actually one that Christian, our chief science officer, invented. So I took him out there a couple times. He had a couple of treatments, and he didn't get out of his wheelchair, but he was so much better. It was unbelievable. Even his imaging on MRI changed. It was really something. Wow. So while I was talking to the neurologist out there, he was telling me, I do, all the different things he does with it, like carpal tunnel and all kinds of orthopedic things and some other, like, pulmonary issues and some protozoan kind of things in humans. And I'm thinking, oh my word, we need this in the horse world, because my daughter was a barrel racer and I had horses at home that were having issues that he was referring to in the human side, and I thought, oh man, this would be awesome. So I went and told my husband, man, I want to bring this to the human market, to the equine market. Let's do this. So we started from day one. I named it. This has been my baby since day one. Thankfully, the owner of the human company, we worked with him, and then we were able to work with Christian, the chief science officer that made it on the human side, and then we moved all over into the animal space. So that's the kind of a long story of how we got started.
That's a really cool story.
But I ended up buying 2 pregnant mares because we needed tissue, and hauled the first one to Ohio State with Dr. Alicia Bertone, and she helped us for a little while. And then the second mare I took to Dr. Brent Haig, and he helped us with that. And now he manages all of our tissue recovery and all that. So it's been an adventure. So from the beginning, the very first meeting I had with Alicia Bertone was so good. I just loved her. And then I have not seen her again until AAP last week. And she came to our booth and she's like, you're still here. She was so excited. I'm like, yes, girl. We've been climbing and it's been great. I was telling you earlier about this AAP was so good for us because everyone that came by either knew about us, have used us, told us great stories. It was it was just so exciting to finally not have people look at us like, oh wow, what is this? So it was good. It was really good.
It does always amaze me because I've been using Renovo for 5 or 6 years now.
You were one of the early adopters, yeah. And
I can tell you, I tell people all the time, I've got 3 different PRP machines sitting over in the lab right now, and they all have dust on them. Like we converted over to Renovo. I tried it on a case. It was a severe tear in the deep flexor tendon, and normally I'd reach for stem cells. And I don't know why, but I said, you know what, we're going to treat this one with Renovo. I want to try it, and did. And what I saw with that horse, following it all the way through, ultrasounds every 30 days, I saw it. I remember that time I said this was at least as good as stem cells. And I mean, we used a ton of stem cells here, both allogenic, which is from other horses, and then autogenous grafts from that horse. I've used both over the years and was a big stem cell person. But then the results I started seeing from Renovo just blew me away. Like, that horse made the difference. I'm kind of an all-in guy. If I believe in something, I am 100% in. And after that horse, I have treated. I've lost count of how many doses we've used over the years.
I know I ship a lot over here to you.
Yeah, it is. Like I said, it's completely replaced PRP, and for the most part, we've gone from harvesting stem cells 5 or 6 times a month, plus the allogenic grafts we'd have shipped in. We've gone from that to maybe 2 cases a year. I mean, there's only very specific cases I still reach for stem cells. Interesting enough, the first line of defense on those horses is still Renovo, and then they mainly meniscal tears is where I'll grab a stem cell still.
Yeah.
But their first line is Renovo, and then we have the stem cells followed up. And
Yeah.
I need to try some.
Interestingly, our chief science officer comes from the human market, and he opened the first umbilical cord blood banking system in Phoenix. So he has a long history in the stem cell world, if you will. But those were cord blood, where they'd harvest them from the mother's donated cords during scheduled C-sections, and or even probably not even have to be C-sections, vaginal deliveries, and just so he's done all that work. And he will say loosely, all the things that you're wanting that stem cell to produce is in amniotic fluid. Now, about 1% of the amniotic fluid in the membrane are mesenchymal stem cells, but those are actually purposefully removed, because if we had stem cells, we're considered a drug per the FDA. And so, but he says, the stem cell is just a tool, and all these proteins, anti-inflammatory cytokines, growth factors, that's really what you're wanting from the stem cell. So it's really not to, belittle the stem cells, if you will. They do have a place for sure, but regeneratively, really what you want is the anti-inflammatory cytokines to shut down the inflammation that you have, and then come back with the growth factors. And the really cool thing to me are these temp molecules, and their job is to break down the scar tissue. So, I tell people, when you look at an ultrasound of a human baby, you see all the extra skin in between the fingers and the ears and the nose, and those little molecules are what go in and clean those areas up and make it pretty. And so when you put that in a soft tissue lesion or even in the joint, it helps break down scar tissue. So that's really a differentiating factor between a lot of other modalities and Renovo, and it's very high. Now, you'll find that in some PRP and IRAP kits and things, but it is very, very high in Renovo.
Well, I'll tell you, before we get too far ahead of ourselves, because
okay, am I getting ahead of you?
Well, I'm gonna go ahead and tell you, this is a topic, and if y'all haven't listened to it, we've got another podcast that kind of discusses the basics of regenerative therapy, and they have to kind of warn me every time we do one of these, because I get really excited about regenerative therapy. Like, this is like, I will way over nerd this. So before we get into over nerding, let's back up. Let's talk about what is Renovo. Where does it come from? How are y'all making it? What is Renovo?
What it is? Okay, so Renovo is it's called an amniotic tissue allograft. So it's kind of like a tissue transfer, transplant, or a skin graft, if you will. So it comes from the placenta and the fluid, the amniotic fluid. So when the mares are foaling, and we get our collections from Pine Ridge Equine Hospital in Tulsa, Oklahoma. So the mares foal, they capture the placenta and the fluid. Now, they have a whole program for this, so as clean as possible in this scenario, that's captured and it's sent to our lab in Phoenix. So Christian, our chief science officer, he removes the chorion, which is the mama side, and there are a lot of kind of trashy things in there, if you will, waste and stuff. But the amnion is the foal side, and the amnion is micronized into little bitty particles, and then those are suspended in the amniotic fluid. Now, Christian has a 42-page process to make that happen, so it's not like, oh, hey, let's just take some placenta, dry it out, and do, especially when you're going into joints and soft tissue lesions. So it sounds simple, but he has a 42-page process to make that. So once he's finished, he puts it in these little vials, a 1.5 cc, a 3 cc, and a 5 cc, and it's frozen at -80.
Right.
So when you cryopreserve it and freeze it, then it maintains the stability of the proteins and all the bioactive factors in there. So when the vets are ready to thaw it out, they take it out of their freezer, thaw it out, draw it up into a needle, and can inject it into tendons, ligaments, joints, whatever they see the need for. So that's basically what it is. It's just a little injectable. It's just an injection, and it comes frozen in a little vial, and the vets can just put it right in. So, but it is tested. All the mares are tested before thoroughly, and then the incoming tissue is tested. He's tested during process and post processing. So every one of our batches go, for testing. And if even if one little sample has anything in it, the whole batch is discarded. And we follow it very closely. All of our vials have lot numbers, and we can tell you exactly where that vial came from, what horse, and everything. So it is manufactured to human standards.
That's awesome, and I think that's one of the things I love is the quality control of the product, because that's very important to me as somebody that's using it. Yeah. So when you're talking about, you've got all these proteins that we're going to harvest, and when you go back to the crux of regenerative medicine, it's basically taking what the body would normally do and basically making it work better. Higher levels, so higher levels of growth factors, higher levels of anti-inflammatory proteins that would normally be produced, and then we're putting that back in to help the body heal. So I always say regenerative medicine in a nutshell is we're going to hijack the way the body naturally heals. We're going to supercharge it and let the body do what it wants to do. And I think that's why regenerative medicine is so effective. So when we're talking about these proteins, right, so there's a lot of different proteins in there. So we talk about, you got the anti-inflammatory proteins. So if you're dealing with an injury, whether it be a joint, tendon, or a ligament, getting the inflammation under control, obviously that's step one.
Correct.
Stop it from getting worse.
Yes.
Before we make it better, we got to stop it from getting worse.
Correct, yeah.
And so on the anti-inflammatory side, we got three big ones, right? The alpha-2 macroglobulins. We've got the IRAP protein, which, IRAP was kind of the first, regenerative therapy on the block.
Yes,
That's the IRAP protein. There's a product produced called interleukin-1 that makes everything angry, and this blocks the pathway so that you can have interleukin-1, but it's not actually hurting
Correct,
anything.
yes, yep.
And so it's actually higher in that than even the IRAP products.
It is, yes.
So this is a very potent anti-inflammatory, because you combine that with those alpha-2 macroglobulins, and then also IL-10. I always joke, he's like the unsung hero of the anti-inflammatory world. He doesn't get near as much credit as the big guys do. Yeah. But he's still a potent anti-inflammatory.
Well, and Christian has characterized all three of those, and they're very high in Renovo. Yeah. And the really different thing too is ours is Renovo is very consistent batch to batch to batch. Yes. So when you're drawing that blood off and you're having to use a kit, what we say is stall side manufacturing. So the veterinarian becomes the manufacturer, and then you really don't know from kit to kit to kit what you're actually getting. I know they're trying to do some things to create some consistency, but so that is a really great thing about Renovo. He makes sure it's manufactured within a certain range. Since it is a natural tissue, it's hard to have exact, like it's not a drug. So, but it is very, very consistent and very high. And A2M is extremely high too. It's not as high as what we've tested in a kit, but it is very high. And when you combine everything together, that's where you get the best result, because it's like making a cake. You need the egg, and you need the flour and the sugar. You need all the things to actually make the cake. So you can't just take one or two of the ingredients and have this nice cake. So to take just one single protein and before it's the best you had, but now that we've got this, that you just have more. You have everything that works together in one area, or in one modality, if you will.
Well, and that's what I've seen is, and I'm glad you brought that up, because I'm often asked, like, what do I see clinically the difference between PRP and IRAP, or not IRAP, PRP and Renovo, and why did I quit using PRP? The variability. Some of the things that float around in my mind. Now, this is the world according to Dan, so I've got zero literature behind this, but horses that get hurt, are some of these horses, do they not make enough of these growth factors to heal themselves? Mm-hmm. And then you've also got, we know if these horses are on high levels of NSAIDs, we know that can play a role on how many growth factors they're producing. And I always say, like, we're taking a chance, and hope's not a plan, but when we're pulling blood, we're going to pull 60 cc's of blood to do PRP. Uh-huh. And we're going to hope we get enough of these growth factors to get us where we need to be.
Right, yeah.
Renovo, I grabbed that vial. I know for a fact I got minimum levels in there. Mm-hmm. I know we've got enough. And I think that's one of the things, reducing that variability is a big thing. Right. In getting these horses to heal.
Yes. Well, and, you're going to get different amounts of proteins based on their age, too. A 4-year-old, you're going to get it much different than a 10 or 12-year-old. And then if they don't feel well, if they have a bad injury and they're inflamed, their SED rates through the roof. I mean, you're just going to have different.
Even hydration status plays a role.
Nutrition, hydration, exercise, all of that affects their metabolism and their metabolic rate and what's going on. And so, so it's sometimes that's the best you have, or sometimes that's all you can afford. You know what I mean? There are going to be times. It certainly has a place. Right. But I
don't want to discount PRP, but what I've seen that makes the Renovo worthwhile is I take as many variables out of that equation as I can.
Yes. Yeah.
And it removes those variables, and I think that's partially why we get such great results with it. I think the other one's exactly what you said. So we talked a little bit about the anti-inflammatory proteins that we've got, but then we've also got, like I said, the temps. But it's inhibiting, it's helping to remodel that tendon or ligament injury. And I think that's very important, because one of the things that we really focus on is we don't want a ton of that type 3 collagen getting built up in there. If you go back to other podcasts, you can learn all about my hatred of type 3 collagen. Looking for that type 1 that's nice and linear. And I always say the difference is type 1 collagen, you've got a cable. Type 3, you've got a lot of yarn. And if I were to say, hey, we're gonna climb off this mountain, do you want cable or do you want yarn? Everybody wants the cable. So we want that type 1.
Yeah, I tell people, like, a scar is like sewing silk, which is your nice material, your nice material, if you will, to a piece of leather. Right. And so the leather is going to be the scar. The silk's going to be your nice tissue. And when the force comes, it just rips right apart.
Every time.
And
so having those anti-fibrotic growth factors in there, again, it'd be like making a cake without the eggs. That's a great analogy. So you don't have eggs, that cake's not going to come out like it should.
It's not going to taste well, it's not right, all the things, But it is one thing that I love about just what we're doing is Christian. I mean, he is a scientist at heart. I mean, he loves to characterize all these proteins and find out what else he can find out about it. And we have a dog product now, and it's called Alpha Flow, and he's characterized these molecules that he worked a lot with in the cancer field.
Oh, wow.
And so he was so excited. He called me one day and goes, this product has tryptophan. So he was so excited. And that is actually a protein that inhibits some of the pathways for metastasis, I think. So, but now that's a lot of study. But he does know what those are, and he has worked with them and seen them in the cancer field. So he was so excited.
I always say God bless the nerds, because we didn't have them. We wouldn't be here right now.
Well, and we have our PhD gentleman that works with us. He has a PhD, and he comes from Wake Forest. Now, he's a North Korean. He's a South Korean. Right?
South Korean.
South Korean. And he is brilliant. So when he was at Wake Forest, he helped 3D print one of the first kidneys that has functioned in humans.
Really?
And he did it from amniotic stem cells.
Oh, that's cool.
So he is the other one on our team. The dude is beyond brilliant. No joke.
That's awesome.
And he's real quiet. And so he was with us at ACVS and was in our booth with us. And I was telling everyone how smart he is. Like, y'all, this guy is the smartest guy in the world. So I'm just happy. Like, I kind of blazed a trail. I've been a chiropractor since, I started chiropractic college in 1985. I graduated when I was 23. So in 1989, it was not popular to be a chiropractor, but I've always kind of had this blaze the trail mentality.
Right.
So this is just an awesome blazing of the trail in the veterinarian space. And it is hard to get people to change, but once they see the results.
Oh.
Yeah, you go from buying 1 to 3 to 5 to 10 to 20. I've got one group that'll buy 100 at a time. So once the vets begin to see how awesome the results are, then they just buy more and more and more.
No, it is. Like I said, it's a go-to. Sometimes I sound like a broken record. Every time there's a tendon or ligament injury, it's like, all right, we're going to get some Renovo. And I think the only thing that matters to me is how much Renovo I put in. Other than that, it has just been, to me, it's been a game changer. The number of horses we've helped with it. And like I said, I think the cool part is the more we learn about it and the more we understand its role. And I love the analogy of the cake, because I don't think there's a better analogy than that, because you do have to have all these things. And one of the things that we saw with stem cells, I was working with a group out of Texas on this, was if you have these purified stem cells, they're just straight stem cells cultured up in a lab, they do pretty well. But I was using another product, and again, they were working on collecting the data to try to get some stuff published, but they actually had the exosomes and the extracellular matrix proteins along with the stem cells. So it was just a culture and expansion. They were actually taking just the raw stem cells along with this extracellular matrix, and the difference we were seeing there was phenomenal. But again, it was about having all those ingredients. If you just have that one thing in there, it may or may not work. Like you said, if you don't have eggs in your cake, it's not going to work. If you don't put sugar in there, it ain't going to work.
Right, yeah.
So,
and definitely need some baking soda.
Definitely need the baking soda. You got a really flat cake.
Yeah. So Christian has characterized the exosomes in Renovo, and there's about right at, give or take, 3 million picogram per mil.
Oh, wow.
Yeah, per mil. So, and the exosomes, for those who don't know, are just little vesicles that actually carry protein around and release protein. So it's just another way to get the proteins. But, and then of course the extracellular matrix protein, we have all of that. It's just, that's what, it's just all in the amniotic fluid, because that's what made that fold to begin with.
Yep.
And so what I also like to tell people is, when you have the sperm and the egg come together, of course you're going to have the two cells, and then as those two cells proliferate into 4 cells, they secrete amniotic fluid and bathe those 2 cells, and then as those divide, then the 4, as they turn into 8, they secrete more. And so this cellular, in the very beginning of development, that fluid just bathes and bathes and is telling these 4 cells to turn into 8, and 8 to 16, and 16 to 32. So it is the fluid that actually made that fold to begin with. So I'm not sure that there's a better fluid, out there than what actually made it to begin with. So and the first time, like when I heard that neurologist tell me what he was doing, I was just like, and he was explaining it all to me, I'm like, oh my word, to me this is the most brilliant thing in the world.
Yeah.
But now I loved anatomy and physiology. That was my thing when I was in chiropractic college. And then after I graduated chiropractic college, I went 3 years postdoctorate in neurology. So I'm actually a chiropractic neurologist.
Oh, wow.
So I was trained under Ted Carrick, who's one of the top chiropractic neurologists in the world. And so I knew a little bit more than a lot of your average chiropractor. I'm like, oh my word, this is so brilliant. But I'm kind of a nerd out on that too. I don't sound like a lot of times, but I'm really a conceptual person more than actually really detailed. am more of a global learner than, all that. So I saw the big picture and I'm like, oh my word, this is brilliant. This is so brilliant. And now it's playing out. It's taken a little while. It's been actually 7 years, but it's taken a while. I had a friend tell me about this book, Crossing the Chasm, and it's about bringing new products to market and having to, get through the innovators and the early adopters, and you're always going to have these laggers that, take forever to kind of get on board. And then your average person, like in the bell curve, your average person or the average in any industry, the average people don't really like the innovators because they're like, hang on a minute, these people will jump on anything, So it has been interesting to watch the veterinarian space adopt Renovo because it's just, I'm glad I read that book, Crossing the Chasm, because it really talks about the innovators and the early adopters and then the late adopters, and then you're going to have some that won't ever get on board. And when you understand that, you just watch it, that's all you can do.
Well, I think that's a really great example because that's one of the things that we've seen in vet med, and I feel like on the equine space we adopt faster than other parts of our profession, but at the same time, it seems like sometimes it feels like it takes forever to get something new going.
When there's so many options.
Right.
That's what Dr. Bertone was telling us. She's retired now, and so a lot of people will call her she's doing consulting now for regenerative things because that's where her field. And so I think she went around to, a lot of the different booths at AAP and was just learning what are our options now and what are they. And at the very end, she came back to our booth right before we left and she goes, "You're the only one doing it right." So she scoped out all the different things, and Christian showed her this gene array now that we have from this gal over in Vienna that has a chip model for osteoarthritis. And we have some really great data from that. And so he was showing Dr. Bertone that, and that's just, that is the next level research, which is way over my head. I'm like, I don't even know. If you say so, I believe you. That's what I tell him. I can see what you're saying, but I don't, and that's way beyond my pay grade.
Well, and I can tell you, that's been the cool thing about Renovo, like coming on as one of the early adopters, is watching the different things we're using it for. When I first got it, it was like, hey, this is tendon and ligaments. This is what we're going to use this, tendons and ligaments. Get it in the tendon, get it close to the tendon. Yeah. just get it there. Yeah. And it'll take care of the rest. But also, and they've now got a safety study on its use in joints. I'll be honest, I was putting it in joints before.
We had the safety
study. I was like, well, this is sterile. Yeah. I really need everything it's got. I think my first ones were some of these collateral ligament injuries. And I was thinking like, all right, well, how can I treat this collateral ligament? Especially like a coffin joint where you can't get access. You sort of can, but it's difficult to get full access to that ligament. And so then what I did is I just started saying, hey, well, let's just put it in the joint. And, looking through the amount of IRAP, looking through the things that were in it, I got to think, I was like, I shouldn't see an issue here. Like this should actually, everything in here should be good for this joint. And so we started putting it in joints. And I can tell you it's been a fantastic tool in our hands in these joints. Not just, you've got the arthritis, but when you're dealing with some of these others like collateral ligament injuries, or if you're dealing with stifle meniscal injuries, meniscal tibial ligament injuries, it has been fantastic, the results we're seeing with that.
And most of the time, you can use it just one time.
Right.
Now, they're definitely on occasion, when they're really bad, you're going to have it twice maybe, and even 3 times. But for the most part, if you don't have a really, really terrible injury one time, you're going to do pretty well. But in some vets just have a preference. Some want to get it well and then top it off with another dose just for safe measure. And I'll have vets call me and say, okay, my client said this works so good. When can we do it again? And I'm like, well, maybe you don't need to do it again. Just wait and see. But another cool thing that Christian has done, there is some research on the human side, is those micronized particles, they actually adhere to surrounding tissue. And while they are embedded, if you will, in that tissue, they continue to secrete the anti-inflammatory cytokines, growth factors, and all the things. Some of them up to 30 days, depending on the protein.
Oh, wow.
he's characterized the A2M and TEMP2s, and on his chart, they really do peak at about 17 days.
Okay.
So that's another great thing, because like HA, on the human side, he did a lot of work with Dr. Kevin Stone out of San Francisco, and he's a huge orthopedic. He was, orthopedic surgeon to the Olympians, and he has one of the top research facilities in human medicine. And Christian used to work with lot with him, and they did a study with HA, saline, and one other, maybe a steroid. And the HA is gone out of the joint in 48 hours.
Right. On
the human side. I would suspect it's the same.
It's about 4 days on the horse side.
On the horse. But so once you put it in there, you got a little bit of time when you use the HA only and steroids, but the Renovo will be in there longer. The micronized particles. Now the liquid probably goes ahead and goes away. We don't know for sure, but we do know that those particles will continue to secrete. So that's that's just another level. And so I'll tell people, look, don't just give it 4 weeks. And it's not a steroid. A lot of people want a lot of just horse, folks, if you will, Beryl, or whoever, the riders.
Yes.
They are so used to using steroids
right.
and seeing immediate reactions or a decrease in inflammation. And Renovo is different. It doesn't act like a steroid. It's a longer term. It takes a little bit longer, but it's longer lasting too.
Right.
So
I always say regenerative medicine's like the slow cooker method, the crock pot.
The crock pot.
and steroids, that's kind of a microwave. And I always tell people, when you need something quick, pop it in the microwave and let's get something to eat. But if you want something that's good, you need to be looking at these regeneratives. It's going to take a little bit longer. And and that's what I've seen, and a lot of it I think is us having to not just. I'd say the best I heard is I'm a big regenerative ag guy. I farm on the side. I love regenerative ag. And there's a guy up in North Dakota, he once said, you don't have to change it's not about changing how you think, it's about changing how you see and how you look at things. And I think that's where we're at with regenerative medicine right now, is you got to change how you're looking at the situation, change how you see it. And I can remember when I first started using a lot of the biologics and joints and Renovo as well, is I was using these joints that had no other hope. We tried everything and it wasn't working. It's like, all right, nothing else working. Let's try Renovo.
Yeah.
Well, then it worked. And I remember laying in bed one night and I woke up and I'm sitting there staring at the ceiling and tossing and turning. And my wife's like, what are you doing? And I said, well, if we use this when nothing else works,
won't use it.
Why don't we use it before?
Right.
If it'll work when nothing else is working, why aren't we using it sooner?
In the beginning, right? And, first thing. It should be the first thing you grab, not the last. Yeah.
And granted, if that joint's on fire, maybe that's not the time to grab it.
Yeah.
But we're starting to see some of this. Well, why aren't we using it sooner? And it completely changed how I saw therapies.
Yes.
And same thing with, I really started doing this. I was looking at some of these tendon and ligament injuries, and they would be mild injuries. Nothing was severe. Probably, the equivalent like a sprained ankle. We're looking at 6 or 8 weeks off, and that used to be how we treat these. Like, all right, let's just give them a few weeks off, and they'll be fine. And then got to thinking, I was like, well, now we're back into the hope category, right? And hope's not a plan.
Exactly.
Why don't we go grab some Renovo and let's go ahead and put it in there, and let's, I always joke, I like to kill mosquitoes with sledgehammers. I don't want to back up because that takes time, right? So if I get you better for a few months, but then we re-injure, I haven't helped you. But if I can go grab Renovo, put it in, and kill that mosquito with a sledgehammer, and then we don't have an issue, and we're moving on, that's better for the horse. It's better for the rider because we don't have more time off. We just keep moving on with life.
Well, and another thing is, even if you put them out to pasture to heal on their own, you get that natural PRP effect, if you will, and that natural scarring. So even just throwing them out, you're going to be better off to do some Renovo to inhibit the scar tissue formation. And I do read a lot of people say, put them out in the pasture and let them heal on their own. And that's okay, but you're still getting that scar. So it's probably not going to completely keep the scarring from happening. Renovo is not, but it will definitely minimize it. And so even, like you say, just even minor micro traumas over and over and over, and a joint's kind of like working in a factory. Eventually, somebody that's doing one-armed work in a factory is going to end up with lateral epicondylitis, and their arm's hurting. And even though you don't have a huge injury, you have these little micro traumas. And riders just, the horses that they use them a lot every weekend. That's what we have a lot of riders that just use it for maintenance now.
Right.
You don't even know you have something going on in there, but if you use it for maintenance, it can help just manage any little micro traumas that you have.
Well, and that's a good point that I haven't really thought of, but using it, some of these horses come off a long, hard show season. We know we have inflammation proximal suspensory. We know we may have some insertion lesions in the branch that aren't severe enough to limit us from performance perspective, but we know ongoing, because that's a lot of what we see in the sport horse world. We don't see those acute injuries like they see in the racehorse world.
Yeah.
Most of ours are slow, chronic, and eventually get where we've gone as far as we can.
Right. Yep.
And if we could use some of these products to not, and again, this is changing how we see the world. I always say, I spent most of my career fixing things, and now I'm trying to look at it more as how do I keep that from happening? How do we stay ahead of this and keep that injury from happening? And that's a big focus where I'm trying to get with my practice. And
I have a lot of, especially the show jumpers.
Yes.
They want to use it before they need
Right.
it. You know what I mean? If you can use it before you need it, you're ahead of the game.
Yes.
So.
And I think it's
going to be a little more expensive on the front side, but you're probably saving yourself in the long run, really.
Well, what I always look at is like we can do it now and keep going, or we can wait till we're broke.
Yeah.
And we've got this injury, and then we're still going to use it.
Yeah.
The difference is now we got to use it, and now you're going to be down for 6 to 9 months.
Right. Yeah.
Whereas if we can get ahead of this on the front side, let's do that, and let's save ourselves that time.
Yeah.
And I think that's as we learn more and more about athletes, I think we're gonna see these products getting used more and more and more, because we're starting to understand. Forever in vet med, we were always reactionary.
Right.
We were reactionary, and now I think we're saying, like, how do we prevent this? Because you get some of these athletes; they're once in a lifetime athletes.
Yes,
we got to keep
for
them.
Sure. Yeah.
And so I think all that.
I know, and I see some of the babies on the racetrack, if you will, and they retire them so early. And I know a lot, but I'm thinking, man, if they could just run a few more races. They love to do it, and they're so good. And when they get, like, I'll see, see it in the news or whatever, just like everyone else. I'm like, oh man, I bet if they put Renovo on that ankle right there, it probably could go again. I'm like, I wish I could get a hold of, so and so, let them know about it, But
well, that's the great thing. And, the other thing I love about it is, I do some work out of the country, and you can't transport these large pieces of equipment that we need down there to do other things. And I love it because, I'll wrap this stuff up in ice pack, get off the plane in Grand Cayman, and go through and treat horses. And it's been a life changer for me down there. The number of horses that we've been able to help, where before all they had was rest.
Well, I tell you what, next time you go and you need a vet tech, I'm not licensed, but I can certainly get a plane ticket to go help. I'm sure you need help. I can thaw it out for you.
Yeah, there we go.
I can make your thawr. Yeah.
It is always easy to find help to go down there and.
I know. I told a guy at AAP the other day, he does a lot at the Kentucky Derby, and I said, okay, now I know you're going to need me to help you at the Kentucky Derby. You just let me know. And Rocky Bigby works with us. He's like, Ginger, you can't do anything to help him. I said, yes, I can. I can carry his drink. I can carry some paper. And you know what? I can adjust him, too, if he needs an adjustment. So I can take care of all that for him.
And thaw the Renovo.
There you go. Yeah. So.
But yeah, it's
it's been an exciting journey, and but you know what? Veterinarians are the nicest people in the whole world.
Really?
I could not think of another group of people that I'd rather work with than veterinarians. Y'all are the best, sweetest, nicest, hardworking people that I've ever met. And I've been around a lot of folks, in my chiropractic world, and then I grew up, my parents owned convenience stores and nursing homes, and then in the McDonald's world, and then, I don't know, I just think veterinarians are the nicest people. So my third daughter is going to go to vet school.
Really? Is she in school now? Or?
She's finishing her degree in May.
Right.
And then and that's why I'm in Georgia. She got engaged yesterday, or what is today? Today's Saturday.
Yeah.
She got engaged. So we're here, and then we're going to go look at some venues because she's and her little boyfriend or fiance now is in school at Auburn.
Okay.
He's finishing his MBA at Auburn. So I don't know. She may just move over there, and I don't know. I said you're just going to have to apply. She may go to she may try for UGA or Auburn, but. I mean, Texas Tech or Clemson's opening. When is Clemson? Like January 26th? Is that the first class?
26.
So, my mother-in-law has a lake house down here on Lake Hartwell.
Oh, nice.
So and then my mother-in-law lives in Stone Mountain. So my husband, we're kind of Georgia. They're kind of Georgia people over here.
So is your husband from Georgia then?
He's from Atlanta.
Okay.
He's from Stone Mountain.
Stone Mountain. That's right up the road.
Yeah.
Well, that's cool. I'll tell you, I encourage everybody. I love this profession. I went, it was a pure accident how I ended up in vet school, but I absolutely love it. And I agree with you. I think veterinarians, especially equine vets, I think are some of the greatest people in the world.
They are, yes.
And truly love what they do. I can tell you 15 years later, and I'm still as excited every morning I wake up as I was the first day I woke up.
And see that you don't feel like you're working.
No.
That's how I was in chiropractic. Like I practiced for 15 years, but I never felt like I went to work. I loved what I did. I loved the people I worked with and just all my patients. And so this has translated well for me being a chiropractor just because I just have a heart of taking care of whatever, things, people, animals, just that's just what I did. I've even thought about just being a patient advocate for people in hospitals because I can manage care, you know what I mean? Like, you need to do this, and this. So, but I just, veterinarians, I just think you are the greatest.
Well, and I'll tell you, I love our industry too because I think about this as y'all had an idea. The number of mares I fold out and taking the placenta. And just, the placenta comes out after the foal does, and you're like, oh, what do we do with this? Like, oh, it's all there. Let's put that in a bucket. And we didn't realize the power of what we had in our hands. And then y'all took something that was basically a throwaway, and y'all have found what may be one of the best things in the world for treating these injuries. And it's just really cool seeing somebody like you that comes up with an idea and then pushes, and like I said, it's been a long battle. You had to get the product made, and then you had to convince people to use it. And I'll be honest, I remember one of my trainers over in Athens had told me about the product, and I was like, I'm not so sure about that. I don't know that I want to be a beta tester on this. And so I wasn't the first ones on it, but after that initial study came out, I was like, oh yeah, we're going. And then once we did, again, I'm an all or nothing kind of person. And so once I saw what it did, it changed. Like
well, we had a friend of a friend get us an appointment with Dr. Haig, okay? And we walked in. Of course, we didn't have really, I don't know that we had anything equine. All Christian had was his human stuff, because he made 9 different products from amniotic tissue on the human side. And he's, we have 8 patents on Renovo, so he's done a lot of work on it. But, we walk in and Dr. Haig's like, oh, God, here comes some more folks, and he's so nice. He just listened to us, And then by the time Christian, explained everything, boy, he was perked up, and he's like, wow, this guy knows what he's talking about. And boy, before it was over, he had him show him around everything, his whole clinic. And so he jumped on board with us right away to help and see if this is a thing or not. And, I don't know, months into it, I'm like, Dr. Haig, does it work? Does it work? Does it work? And he kept going, big patient, grasshopper. I'm like, quit calling me a grasshopper. and then finally one day, because they were doing before and after MRIs, and he's doing all the things. And one day he's like, okay, Ginger, this magnet does not lie. This stuff works. And so to get Dr. Haig on board, now it took a while, oh my word. I kept calling him, going, is it working? Is it working? Ginger, I'll let you know. But I need to know I've got a lot of money invested in this, And but he has been so unbelievably helpful, Dr. Haig. And, he reached out to his 10 different colleagues in the very beginning, and they were willing to help us. And that's where our first beta study came from. And he has been just unbelievable. helpful, and just he understands the science, and he's so smart himself. And I can't tell you how many times I've texted him, Dr. Hay, can you call so and so? Dr. Hay, can you call so and so? And I mean, he always immediately takes care of it for us. Now, thankfully, some people's like, who are your sales team? And I'm like, the veterinarians sell it for us. I don't even have to have a team; they sell it for us. So.
I always say it sells itself. I tell vets, like, if you're unsure, try it one time. If you don't like it, you don't have to use it again.
Right? Yeah.
I hadn't had anybody say they didn't like it yet.
Yeah.
And like I said, I love the product. I mean, that's why we were so happy to have you on today, because it's been a really, really cool product. And I think that's the thing I love about Vet Med is when you get these new things that come out and you get to try them and you get to use them. And I think about the lives we've changed
exactly
with some of this stuff. I mean, it is, used to, when I got out of school, a suspensory injury had the potential to be in career ending. I tell people all the time now, I was like, it's a bump in the road.
Now, yeah.
It's a bump in the road. And they always say, well, what's the risk of re-injury? I was like, if this works the way it should, and majority of the time it does, there's no greater risk of re-injury than before the injury happened. And I've seen that over the years I've used it is, we treat these horses and they go and have great careers.
And that's what,
really cool.
Like that Senor Bascador, the horse that won the Saudi Cup, had a suspensory injury. And Dr. Tommy Hayes used Renovo on the suspensory, and it went back to win the $40 million Saudi Cup.
That's really cool.
And he texted me one day, he's like, Ginger, did you see where I gave you a shout out in the Pollard report? And I'm like, no. So, of course, I'm finding it. And but yeah, he used a Renovo on that horse's suspensory injury. So that was really cool. And then our gal, I actually was able to take her personally some Renovo to Germany for the paradressage gal that did the Olympics. Yeah. And she won the 3 gold medals. So I was able to go to the Olympic Training Center for the paradressage team.
Oh, wow.
In Germany. And then, so yeah, we've just been it's really cool to see all the things that we've helped, and it's been really nice. But when I saw on Facebook you're doing this podcast, and I thought, I'm going to be over there. I need to be. So I chased him down at the restaurant in Orlando. I'm like, I need to be on your podcast. So
and I'll tell
thank you for having me.
Oh, no, thanks for being here. I mean, it's really cool. You're actually our first guest on the podcast.
Okay,
you're our first guest. Like I said, we're still kind of up and running with this. And, it's been a fun journey for us, the amount of information that we can get out there to people. And, that's what I love about the podcast is, so many people are listening to them. And, we can educate more people, and we can really help. Before we were helping our little community around here in our horse population. Now with the podcast, we're hoping to make lives better for horses everywhere, and to really explain things. That's a big thing to me, is be able to explain things where horse owners can understand. Because I always say, if you talk to a rocket scientist with NASA, putting a man on the moon is really not that hard. It's just a series of little problems you got to solve. Medicine's not that complicated. It's just a little series of things we have to do, and that's one of our big things, to be able to help people to understand this.
That's good. Yeah.
Well, Ginger, thanks for coming in today. I'm so glad you tracked me down at the restaurant to come on the podcast. It has been a fantastic time. So,
and Warren, Warren.
Warren, yes.
So his new father-in-law is Rocky, who works with us. So he did his master's project at Auburn on amnion and wound healing back in 1980. He always says, know your business. But I think it was about 1984 or something like that. So,
well, y'all got a great one with Rocky. Yeah. I mean, he's been around the industry a long time, and just great vet, super person. Yeah. Just all around, y'all did really good.
Well, when he said the first time I talked to Christian, he said, I knew that man knew what he was doing. And his idea of retaining the bioactive factors was the key. And when he had a process to do it. So he's invented that process and patented it. And so, well, thank you so much for having me.
Absolutely.
I think our time's up, right?
I think so.
Okay.
Well, thanks for being here. And y'all, thanks for tuning in. And again, if y'all have got other questions you want answered, if you got other topics you want us to cover, you can email us, text us, call us, DMs. That's been my new education. I've learned what a DM is on the podcast. You can DM us, throw something in the comments. But again, Ginger, thanks for being here. And thanks y'all for tuning in. And we'll see y'all soon. Take care.